Diabetic eye disease occurs when a person has had a combination of high blood sugars associated with diabetes, along with elevated blood pressure levels and elevated cholesterol levels. And what happens over time is that the small blood vessels near the center of vision, and again throughout the retina, will start to deteriorate and become damaged due to the high sugars, pressure, and cholesterol. The way that diabetes affects the body is to affect what we call the microvasculature, or the small blood vessels throughout the body. Your primary care physician, I'm sure, has spoken to you about how diabetes can affect the vessels in the brain, the heart, the kidneys, the fingers and toes, as well as the eyes. We're lucky because we can look directly into the retina and see the amount of damage that is occurring from the diabetes. What happens over time is that the combination of elevated blood sugar, blood pressure, and cholesterol will damage all of the small blood vessels throughout the body. What will happen in the retina is that just near the center of vision, the blood vessels will start to leak fluid into the retina. And what the patient will notice over time is that their vision becomes blurrier and you notice more distortion. So looking at a straight line, you may notice some waves or bends in the line. What happens with advanced diabetic disease, usually found in patients who have blood sugars that are out of control, a hemoglobin A1C in the double digits, or patients who have had diabetic disease for 15 to 20 years. What will happen over time is that the small blood vessels throughout the retina will actually close off and stop transmitting blood. What then happens is that the tissue or the retina is deprived of oxygen, and it will try to grow its own blood vessels to supply its own oxygen. Unfortunately, what will happen is that the blood vessels will actually grow into the eye rather than into the retina. And what the patient will notice is a sudden onset of floaters as the blood vessel breaks into the eye and fills the eye with blood. What then happens over time is that the blood will settle, turn into scar tissue, which will coagulate over the surface of the retina and then contract and cause a retinal detachment. When this occurs, the best solution is surgery, where we go into the eye, remove all of the blood, remove all of the scar tissue, and try to save as much of the retina as possible. So when should you have a dilated eye exam to check on the diabetes and its effects on the eye? Well, initially, once you're first diagnosed, it's recommended that you have a full eye exam along with a dilated retina exam. This can be accomplished by either a professional eye doctor or by a retina specialist. We recommend that you come to a retina specialist if you're having the symptoms of constant blurred vision, distortion in the vision, or new onset floaters, as these may indicate advanced diabetic eye disease. The reason that we ask patients to have a full dilated exam early and annually is so that we can detect any of the initial changes with the diabetic eye disease. Once we notice these things, we can counsel the patient on the importance of blood sugar, blood pressure, and cholesterol control. We can also treat the damaged blood vessels and try to prevent any additional damage which would occur to the retina. Having annual exams, or sometimes every several months, depending on the severity of the disease, will help save the vision and keep the patient with normal or near normal vision for many years. If you have any additional questions about diabetic eye disease, please feel free to refer to our website, which has quite a bit of information, or if you like, call our office and feel free to speak to our staff, ask them questions, and if you wish, schedule an appointment for a consultation. Thank you.